These numbers are staggering. This represents a huge proportion of the workforce.
Last week, 2 professors at the University of Manitoba compiled as much data as they could on COVID cases in the childcare sector. They now have some results.
The results of the data that they collected is heartbreaking.
The Manitoba Child Care Association says they're taken back but not surprised by the numbers these 2 doctors found. So far, data received between January 6th and the 9th has been analyzed from 332 different childcare facilities, thanks to 4 other doctors joining the project. In childcare centers that have between 1 to 14 staff members, 1/4 of the facilities have a COVID-positive staff member, and over 50% have either someone sick or someone isolating due to being a close contact. When it comes to facilities with more than 14 staff members, those numbers significantly increase.
3 out of 4 of them currently had at least a single positive staff member, and 80% of them had either a positive staff member or a staff member who was isolating because of close contact.
Because the province is not updating child care centers on positive cases amongst children, and parents sometimes pull their kids out of these settings without informing the centers of the reason, the data around COVID cases in kids is not as strong. Through the data these doctors did receive, though, 63% of high-staff centers have at least 1 child who currently has COVID-19. Another staggering number, 75% of the 332 sites have reported that parents are sending their kids to receive childcare while the child has symptoms of COVID-19.
While this is a very disheartening finding, it is not that surprising. There has not been good communication from the provincial governments, from workforces supporting parents to keep kids home.
We owe it to Manitobans, to young children, and to our early childhood educators to ensure that they are protected, supported, both financially, mentally, physically, so that they will continue to be here in the future to support our province.
MCCA's Jody Kale says the province began providing rapid tests for symptomatic staff members last week, and that will help. But these numbers show the problem is much bigger. She's calling for the recommended PPE to be provided to all early child educators and funding for proper ventilation in these facilities. She's also calling for Families Minister Rochelle Squires to start joining the province's health updates and providing parents with the information they need. We reached out to Squires for a comment. A spokesperson says, in part, the province reports cases daily and lists cases by age online. The Department of Families has worked closely with the Department of Education and Public Health to ensure policies and practices on the provision of things like PPE and vaccination prioritization are aligned. Kale and the doctors agreed that if nothing changes, over 50% of the province's child care centers could be dealing with potential shutdowns 2 weeks from now.
I think, unfortunately, we're probably going to find out what happens when we lose access to childcare.
In this natural experiment.
The latest findings are online and can be found by heading to the URL below. In Winnipeg, Mike Albanese, City News.